Okay, so good evening, my dear students. We are now going to have a discussion on the questions of FMG exam for the subject of PSM. Yes, FMG 2023 January. But more than the context of the FMG exam, this is very important for the NEET PG exam, which is just there on the March 5th this year. Yes, so that is the main reason this recall will have some impacts. Okay. Now, the very basic thing which you see over here is that trend of paper. Okay, so I will first talk about the trends of the paper, and probably after the trend we can look into the individual questions. Yes, now if you look into the number of questions, they were 35. 27 were from core PSM as a subject, and 8 were the overlap with other topics, and this is always happens with PSM. Now if I extrapolate this into the NEET PG exam, NEET PG also shows a feature like this, where 20 questions are from the core subject and the 5 questions become an overlap. Okay, so I hope I am clear with this. Now, the major focus topic in this exam was infectious disease and nutrition. So I also expect that in the NEET exam, infectious disease and nutrition would be given a good amount of weightage. Okay. The pattern of question, if you look, was simple to moderately tough. Now, please mark moderately tough. So out of the 35 questions, around 20 questions were very simple, whereas the 15 questions were relatively on the tougher end. And that is why they are those questions or topics which would be reflecting at the level of NEET PG. Okay. Now, I hope those of you who have attended my class, you know I teach in parts. So part 1 concept, there were only 4 questions, which generally happens with FMG exams. The part 2, there were 13 questions, major chunk, important one-liners. The part 3, there were 5 questions. The part 4, there were 2 questions. Part 5, 4 questions. Overlap, there were roughly 8 questions. Remember, these are purely based on recall, so there can be different versions of a question, and that's the reason the answer might differ. So rather than looking just on the question and the answer, just look into the topics. And I have distributed this into chapter wise. So the benefit is you can just look into the chapter and you can look into the questions to make readability easier. Okay, let us start. Due to increase in lung cancer in India, the government started a tobacco control act called as COTPA. Yes. Which level of prevention is this? Now, let us first understand levels of prevention. There are 4 levels of prevention if you see. One is a primordial level, primary level, secondary level, and tertiary level. Now, please understand, it is prevention. So, my important question is what it prevents. So, if it is primordial, it prevents a risk factor. If it is primary, it prevents disease. If it is secondary, it prevents complication. If it is tertiary, it prevents further complication. Now, what are the strategies? Primordial, risk factor, health promotion by health education. I go to a school and I say, boys and girls, stay away from tobacco products because tobacco causes cancers. Disease, health promotion by health modification and specific protection. Like I am banning the use of a product. That is because the risk factor is present. I want to eliminate the risk factor. Yes. Screening of disease, it can be seen by complication. Disability limitation and rehab is basically talking about your preventing further complication. Now, if I look into the context of tobacco and health, going to the school and giving health education, बच्चों तंबाकू पदार्थों से दूर रहो, इससे कर्क रोग होता है. Dear students, do not consume tobacco products because it leads to cancer. This is health education. This is primordial. Bringing it under act or smoking ban in public places or banning use of tobacco products, this will be primary. Suppose someone is suffering from lung cancer, I give chemo. This would be basically secondary. Tertiary, someone has suffered from lung cancer, there is metastasis across the different parts and the person is having respiratory gasping. In that case, giving oxygen bag on mask. Yes, I hope everyone understands that. So the answer to this question was primary. Yes. Now, why am I basically explaining this? I am explaining this because the concept is important. Now, they were asking about tobacco over here. in the NEET exam, they might ask you about alcohol. So you need to understand in that manner. Now, this is such an important topic that in the DVT session, we have covered it. In the regular classes, we have covered it. In the TND, we have covered it. And even in the exam, they had asked 2 questions from this, like hand washing during COVID-19 is what level of prevention? Yes, guys. Now, when will I wash hands? When there are germs around. So risk factor is present. So washing hands will be a primary level of prevention. Yes, washing hand will be a primary level of prevention. I hope everybody understands that. Now, it is basically health promotion. This is basically primary mein health promotion. It is not specific to any disease. It is overall a health promotion. I hope everyone is clear with this, no doubt. So these were the first 2 questions from the same concept in the exam. A study was conducted to compare MMR vaccine history among children with autism and children without autism. This is an example of. Now, please first have a look. They're talking about history. With autism is the case and without autism is the control. So we are having comparison of cases and controls. We are having a comparison of cases and control. So this makes this study a case control study. Now let me tell you identification of study design. We have also talked about this in the DVT revision, but also it's important. So I'm again revising it for you. Now whenever you get a question on study design, the very first question which I would prefer to ask is comparison present or absent. Yes, guys. If the comparison is present, my answer will be analytical study or a interventional study. Yes, guys. If the comparison is absent, it will be a descriptive study. Now, when I talk about the descriptive study, if it is for rare diseases or it is for common or chronic diseases, if it is for rare disease and the sample size is 1, this is a case report. If it is more than 1, it is a case series. Yes. So any rare finding, imagine you are a cardiothoracic surgeon and you get people where the heart is in the abdomen. It is a rare finding, so it will become a case report. Yes, it is a number of people in an area are having missing of limbs, phocomelia. This will be a case series. This will be a case series. Now, common, chronic, snapshot based. If it is a single snapshot, then my answer will be cross-sectional study. If it is multiple snapshots, if it is a multiple snapshot, this is a longitudinal study. Single snapshot, cross-sectional study. In this, we will be calculating point prevalence. In this, we calculate period prevalence. Yeah, Shubman Gill scoring century is a longitudinal study. हर मैच में अब सेंचुरी मार रहा है. Yes, आज रोहित शर्मा ने सेंचुरी मारा. Cross sectional study. Yes, Jasprit Bumrah will play this year cricket. Case report. Yes, we understand in this concept, yeah, context. Yes, okay. Now, interventional study, if it is random, it is randomized control trial. If it is non-random, it is also called as a quasi-experimental study. Yes, guys? Okay. Analytical study. If we have population as a unit, this, my dear students, is an ecological study. And then we have case control and cohort. I hope everybody knows the difference between a case control and cohort. Yes. Now, let me see how many of you know this. Now, this I would like to give you guys as a homework. You need to drop me as a WhatsApp on this number about your homework about the difference between a case control and a cohort. There are 10 top points. I hope you know it. So I'll wait for the answer for this homework. If I get it, great. If I don't, again I will make a small video to tell you in detail on the difference between case control and cohort. So I hope this is a didactic approach or a Socratic approach. Can anyone tell me? Can anyone tell me which kind of approach am I teaching you now? Yes, is it a one-way communication or a two-way communication? One-way or a two-way communication? Yes, asking you to send your homeworks. Yes. Done? Okay, I'm waiting for some messages on the chat box over here. Yes, guys? Two-way, very good. Yes, two-way. So I would be expecting you guys to send a photograph and I'll know that yes, you have read it. Yes, okay. Infectivity is also known as incubation period. No, incubation period basically refers from exposure till the first clinical feature. This is incubation period. Serial interval is from primary to secondary cases. The gap is called as a serial interval. Case fatality rate. This is called as the killing power of disease. Secondary attack rate. It tells you the communicability. So how much is a disease communicable or is infective? So answer to this question was secondary attack rate. Yes, I hope I'm clear. So if more the communicability, more is the secondary attack rate, and that is the reason diseases which have got high secondary attack rate, measles, chickenpox, we do not allow the infected person to come to the hospital or the school or the workplace. I hope I'm clear with this. There is no doubt in this. Absolutely, guys. Okay. Now, a patient came with a class 3 dog bite, previous prophylaxis for monkey bite 6 months back. Now, please understand this is a very good question and has come for the first time in this format. Monkey bite, animal bite, all animal bites are category 3. Now, if it is a category 3 bite, HRIG would have given earlier itself. Now, the classical points which we always teach you people is HRIG is given once in life. We do not give HRIG again and again, because if you give HRIG multiple times, there will be hypersensitive reaction, and that's the reason we do not give HRIG again. So the answer to this question is category 3, wound management plus ARV, but no immunoglobulin. Now, how many doses of ARV? 2 doses of ARV is needed because it is just 6 months back. Yes. Now, please understand, rabies management is a very important thing. And we follow the modified Thai Red Cross regimen. Yes, Thai massage कराना है ना, तो याद रखना, modified Thai Red Cross regimen. Now, this regimen is very simple, either post-exposure or pre-exposure. Post-exposure, there are 4 doses. Now, 0, 3, 7, 28. Pre-exposure, there are 3 doses, 0, 7, 21 or 28. Now, please mark the word or. So, this was 4, this was 3. Now, the rabies vaccine can be given in 2 routes, intradermal, intramuscular. No change in regimen. only the dose changes. Intradermal is 0.1 ml per day. Intramuscular is basically 0.5 ml per day. Yes. Now, intramuscular should not be given in the buttocks. It is given on the deltoid. And if it is chotu bachchu, we know intramuscular is middle part of anterolateral thigh. That's the reason all the intramuscular vaccines bachcho mein are given over here. Now the only पंगा is with re-exposure. Re-exposure means मुझे कुत्ते ने काटा, फिर 6 महीने के बाद कुत्ते ने काटा. In that case, what I am going to do? Now before I explain it, you should understand if it is within 3 months, no vaccine. If it is 3 months to 2 years, I will give 2 doses, 0 and 3. If it is more than 2 years, full course of vaccine is needed. And if pre-exposure has been done, there is no need for HRIG at all. Remember, there is no contraindication for rabies vaccine. Immunocompromised, pregnant, everyone is eligible for rabies vaccine. Because if you suffer from rabies, the fatality is 100%. So you cannot take a risk at all. Yes, guys, I hope no doubt in this. Okay. Next question. A 10-year-old boy presents with rash and ear discharge. Okay. What is the diagnosis? And they are given this image. Now this is Koplik spots. Yes. L. So it is seen always on the lower cheeks. There's a confusion. Some Indian author books say upper, that is wrong. L for lick, Koplik, the lower. This is a classical feature of measles. These days, NEET is also loving these kinds of questions where they prefer to ask you a simple infection disease with simple such images. Okay. Mumps, I hope you can understand. यहाँ पे फूल जाएगा. Yes, or orchitis. Orchitis. Chickenpox, there are vesicles. In rubella, generally they will give you CRS, congenital rubella syndrome. So just picturize these diseases. You will be easily able to get the right answer to this. Okay. Question number 7. Essential components of RCH programming include all of the following except. Now this is actually an old program, but I don't know why they asked. Safe motherhood, definitely. Women education and empowerment, maybe, I don't know. Children and newborn court, definitely yes. Screening and treatment of STD RT, definitely yes. Answer was 2. Now, if as a teacher I will prefer to give you a long list, but I am not a teacher, I am a student turned teacher. So the word student comes first. So I always solve the questions based on common sense. So by exclusion, the answer was option number 2. Yes, I hope it is given. Okay, chest learning, what if prophylaxis is given before 2 years? नहीं, देखो 2 years का कट ऑफ है. अगर 2 साल से ज्यादा हो गया तो यू हैव टू गिव फुल कोर्स. अगर 2 साल से कम है तो यू हैव टू गिव 2 doses. Now immunoglobulin pre-exposure, no cutoff. If someone is taken pre-exposure, no immunoglobulin. Why? Let us understand the concept. See, when you are giving pre-exposure ARV, the body will generate antibodies. So antibody are roaming in your body. You need not give immunoglobulin at all. Immunoglobulins are also antibodies which are given external. So there can be a cross reaction or hypersensitivity. That's the reason it happens like that. I hope it is clear. Chest learning. Yes, guys. Okay. Now, in demographic cycle, highest birth rate is seen. Now see, I hope everybody knows when we talk about crude birth rate or crude death rate. If I look into the stages, crude birth rate high, crude death rate is low. Sorry, both are high. In 5, crude death rate is lower, crude death rate is low, crude birth rate is lower. In 4, both are low. In 3, this is intermediate, this is low. In 2, this is high, this is intermediate. I hope everybody is clear with this. Yes. So H stands for high, L stands for low, I stands for intermediate. Now let me give you a recent update. India has just entered phase 4. Just entered. ठीक है, because classically we were taught that India is in phase 3. Now it has just entered phase 4 with the new data coming out that our TFR has come down to 2. So answer to this question, highest birth rate. Now if you look over here, the examiner was very smart not to give you stage 2, because stage 1 and 2 both have high. Stage 1 and 2 both have high. So to avoid that controversy, the examiner just gave you stage 1, and that is what is the answer to this question. I hope I'm okay with it. Yes? Okay. Now, second trimester pregnant woman having a 2-year-old child, recommended dose. Now please have a look. Someone had just mentioned, yes, someone had just mentioned that we had a gap of 3 years for DT. Now I hope everybody knows we have to give 2 doses of DT to every pregnant female. If less than 3 years 2 doses are taken, then we give single booster DT. Now if it is a single booster DT, answer was this. Now remember, TT is not no more given. There is no more TT. Now we have DT only. Yes, I hope everyone is clear with this. No doubt in this at all. Okay. Now, which of the following is correct regarding the image? Now look at the P2. There is bulging. Yes. This bulging is basically due to protein energy malnutrition. But kwashiorkor basically happens first due to protein deficiency. So answer to this question was kwashiorkor due to protein deficiency. Yes. So there is edema over here. There is edema over here if you see, and that is basically because of protein deficiency. Now I hope everybody knows the difference between kwashiorkor and marasmus. In marasmus, the child will be totally lean and thin like Urvi Javed. Whereas kwashiorkor typical example is Bhumi Pednakar in Mo Moh Ke Dhage. I hope you understand that. You do not forget it. Yes, guys, no doubt in it. Okay, chalo. Now, a primigravida giving birth to a male child without any issues for the mother or infant, after how many hours should the breastfeeding start? As soon as possible. See, for NVD, we say it is half to 1 hour, whereas for cesarean, we say it is 1 to 2 hours. So answer to this question was option number 2. Yes, guys, I hope I'm clear with this. These are very simple questions, direct questions, no doubt. Which of the following is the denominator of IMR? Now, all pediatric mortality. The denominator is number of live births and the multiplication factor is into 1000. Except 2, that is stillbirth rate and perinatal mortality rate. Now what is the denominator for this? The denominator is number of live birth plus number of perinatal deaths. Number of perinatal deaths. Yes, guys, I hope I'm clear with this. No doubt in this. Now, when we talk about MMR, the denominator for ratio is number of live birth, and for rate is number of females in reproductive age group. Yes, guys, no doubt in it. No doubt in it. So answer to this question was option number 2. Answer to this question was option number 2. Okay. 13th. Old question. If you ask me, we used to read this when I was a student for last 15 years. NEET has not asked. It might ask. Per capita space in school should be more than. Okay. Let me give you some facts. A classroom, 40 students. A urinal, 60 students. A latrine, 100 students. Type of desk, minus. Light should come from left side because majority are right-handed. Concept of school health program, Bhor committee. Concept improvised by Renuka Roy. School health examination every 6 months. School health under covered under PHC. So question, per capita space in school should be more than 10 feet square. ठीक है? Yeah, Shubham, I know it's in park, but I hope you know, read the park, in the park and throw it in the park. Otherwise you will be sitting in the park. Yes? So एक क्वेश्चन तो पार्क से बन जाएगा, लेकिन दूसरे क्वेश्चंस बनना बहुत मुश्किल है पार्क से. Yes guys, I hope it is clear, no doubt in this. Okay. A 35-year-old man, Ashok, began planning for a vacation with his pregnant wife and one child. At the same time, his brother and wife came to visit him. What type of family you can across during your visit to the survey? Now please have a look. Male, female, suppose दो बच्चा. See, this is the primary family. The visitor, अतिथि तुम कब जाओगे, yes, are never counted. So this is basically a nuclear family. There should be no confusion with it. Now to count a member of the family, you have to stay together for 6 months. Now imagine if the brother and wife would have stayed more than 6 months, then the answer would have been a joint family, because there are 2 eligible couples. Okay? Imagine there would have been this couple and this lady's sister staying. This would have been an extended family. Okay, so please do not confuse. A 6-month stay is required. Okay, so before that we cannot count as a family. So the person who has gone for the survey will actually ask, ना आप कब से यहाँ रह रहे? So the brother will say, ये मेरा भाई है, कल अपनी बीवी को लेके हमारे यहाँ आया है. देखो, हम लोग प्लान बना रहे थे कि मैं अपनी बीवी को घुमाने लेके जाऊंगा, लेकिन अब मेरा भाई आ गया है, तो अब मैं कैसे घुमाने लेके जाऊं? The reality will be bro code, because the guy would have told his brother, भाई तू जल्दी आ जा ताकि घुमाने का पैसा बच जाएगा, हम मस्त दारू पियेंगे. I hope you understand that. So basically you need to understand that the person has to stay for more than 6 months to be counted in a family. I hope it is clear with you. Yes, I hope it is clear to all of you. Okay. Now, anterior incisors of a child who has white patches on them turn brown following over supplementation. From white teeth, which is white like Bugs Bunny, this has become brown. It is due to supplementation of fluorine, and that is the reason double-edged sword. Yes, double-edged sword. Now, drinking water is the most common source. The method of removing is Nalgonda techniques, and the sequence in which we add in Nalgonda is an important MCQ. The mnemonics is lab. So lime, alum and bleaching powder. This is the sequence in which we are making the addition. Fluorosis is seen in central incisors and first molar. Dental caries will happen if the fluoride is less than 0.5. Recommended is 0.5 to 0.8. Maximum is 1.5. Mottling will happen when it is more than 1.5. I hope I am clear with this, guys. No doubt. Okay. Skeletal fluorosis is 3 to 6, whereas crippling fluorosis is more than 10. Remember, crippling fluorosis, we get to see knock knee. So the knees are like this, knock knee. Okay, I hope everyone is clear with this. No doubt. Okay. Giving class in a village for wound dressing after a dog bite is which mode of health communication, or which is the best way to teach in village? There were 2 versions of the question. Lecture, village में कोई नहीं सुनने वाला तुम्हारा भाषण. Trust me, unless until you're a politician. Flashcard, how many people can see? Yes. Demonstration, best way, because demonstration is basically a way of learning by doing. So it is the best way for illiterate people if you want to demonstrate them something. Group discussion, absolutely not. So answer to this question was option number 3. Now, doctor explaining to the community that after vaccination it won't affect impotency. What type of barrier is this? Now, I do not routinely teach this in class because these are not topics which are asked frequently, but we should just apply a bit of common sense, because there will be questions which are not from your notes and we apply it. Environmental barrier बिल्कुल भी नहीं, physical barrier कुछ भी नहीं है, या तो साइकोलॉजिकल है या तो कल्चरल है ना. साइकोलॉजिकल का मतलब समझो साइको, मुझे समझ में नहीं आ रहा है कि क्या बोला जा रहा है. Whereas cultural barrier, I can understand anything, but I am understanding. Boss, अगर वैक्सीन पिया तो मुझे impotency हो जाएगी. So basically this was a cultural barrier. Yes. So please do not confuse. There might be some sources which tell you the answer to confuse, but this is a logical way to approach. Now, if you look into the theoretical way, physiological, where there is difficulty in learning or expression, psychological, if there is emotional disturbance, neurosis or buddhu banda hai, environment, noise, irritability, something like this. Cultural, it may be custom issues, belief issues. This basically is a cultural barrier. Eligible couple register is maintained at which level? A very good question. This is maintained by the ANM, auxiliary nurse midwife. Where is the ANM present? At the sub-center. Yes. So the answer to this question was sub-center. There are 7 registers at sub-center. You should know the 7 register. Yes. Now, what are the 7 register at sub-center? We have family planning and eligible couple register. We have maternal death review and infant death review register. We have register related to malaria. We have the stock register. We have vital event register. Now there are 3 vital events. Yes. Birth, death, marriage. Remember, marriage is never ever counted. The last is immunization. So these are the 7 registers which are present at a subcenter. So this is the important question which will be important even for the NEET exam. Yes, okay. There was a question where I could not actually get the exact recall. India spends how much money on health related expenditure in terms of percentage of GDP? If you talk about how much India spends, it is 2.5%. If you ask me what is the WHO guideline or what is recommended globally, then my answer would have been 5%. So these are two different answers because these are the two different questions. कितना है? इंडिया का 2.5 है. कितना होना चाहिए? होना चाहिए 5. यस, होना चाहिए 5. तो जीडीपी पूछो, जीएनपी पूछो, कोई ज्यादा फर्क नहीं पड़ेगा. Even if you put it as GNP, it does not make too much of a difference. For us, the values are important. ऐसा भी हमें कहाँ समझ में आता है ये सब है क्या? Yes, guys, I hope you understand. Shubham? Yes, okay. Now we'll look into the overlap version of questions. Ground glass appearance of lungs is seen in which of the following? Bhaiya, ye radiology. Sumer sir would cover this. Yes. Can anyone tell me? Where do we see ground glass appearance? Ground glass appearance. Yes. Radiology. Already Sumer sir has finished it up. Yes. Asbestosis. Okay. Okay. Good, Tanay. Yes. Snowstorm appearance. Snowstorm appearance. Snowstorm appearance. Can anyone tell me where do we see a snowstorm appearance? Snowstorm appearance. Yes. Snowstorm appearance. Very good. Silicosis. These are couple of radiology questions. Please, I beg you, it is not PSM. I don't know how to read it, so I'm not bothered about it. Yes? Okay. Safe strategy for trachoma. Again, this was ophtha, but again, PSM overlap. S, A, F, E, S, surgery. A, antibiotic. F, facial hygiene. E, environment, cleanliness. Okay. Now, let me tell you a PSM fact. Circularizing trachoma is now eliminated from India. Yes. So as a PSM person, I am only bothered about this fact. Baki, ophtha mein Dr. Manish and Dr. Saurabh sir would have talked about in detail. अपना बॉस फंडा क्लियर है, अपने सब्जेक्ट तक सीमित रहो, खुश रहो. Administering a 8-month-old infant with a vitamin A supplements over the course of 2 consecutive days, today or tomorrow, what should be the recommended dose? Now please try to understand, this is a therapeutic dose I'm talking about. The therapeutic dose at one time we give 50 lakh international unit. So 50 plus 50, it makes 1 lakh. Now I'm not talking about a prophylactic dose. I'm not talking about a prophylactic dose. Prophylactic dose is something else. What concerns PSM? So if it is preventive, at 9 months we give prophylactic dose, which is 1 lakh international unit or 1 ml, and then every 6 months I would be giving 2 lakh international unit or 2 ml till the child is 5 years of age. So total I give is a 17 lakh international unit. Yes, I hope it's no doubt. हाँ बेटा, लेस देन इसका बच्चा था 8 महीने के बच्चा था. अब देखो इसमें एक कैच है, अगर एज ग्रुप नहीं दिया है then it would be 2 lakh international unit orally on 2 successive days. 1 साल से छोटा बच्चा था, इसीलिए you made it as 1 lakh. ठीक है? So if it is less than 1 year baby, then the dose is reduced. Yes, Tanay, absolutely good point to pick, and that's the reason I put this also, because I also have the same doubts as you guys have. Yes, so I hope you understand. Yes, so please be clear that there is a difference between the treatment dose and the prophylactic dose. Yes, okay. A patient presented with diarrhea, dementia, dermatitis, इसके बाद मर भी जाएगा. 4Ds. This is a typical condition of pellagra and is seen in niacin deficiency. Okay. Which of the following is preferred to decrease the risk of coronary artery disease? Omega-3 fatty acid. सफोला बोल के पैसा ज्यादा ले ला. Yes, so omega-3 fatty acid, it is polyunsaturated fatty acid which is lot of EPA and DHA. For further details, please contact your biochemistry teacher. Yes, I am not bothered with fatty acids at all, even though given in PARC, but in detail taught in biochemistry, so it is more of a biochem question. Yes, okay. Which vitamin deficiency results in degenerative eye illness known as xerophthalmia, which causes dry eye? Vitamin A है, किसको नहीं पता? हम लोग स्कूल में पढ़ते थे. You remember we used to read in school in biology? Yes, okay. Collagen defect is due to the following: ascorbic acid, vitamin C deficiency. Again, a question from the school. So please do not label this at PSM biochemistry. I will rather label them as school का बच्चा का question. Yes, okay. Which of the following is not a microelement? Good question, but again I will say this is biochem. But still I asked Poonam ma'am about this, yes, because you understand she was my teacher and she is still. There are two types of nutrients actually. One is a macronutrient which is called major element, and a micronutrient which is called as trace element. Now, when it is called macro, जब more than 1000 चाहिए, less than 100 चाहिए तो micro. Calcium, potassium, sodium, magnesium, phosphorus, these are all called as macro elements. Iron, iodine, fluorine, copper, cobalt, these are called as micro elements. There's also trace contaminants with no known function: lead, mercury, barium, boron and aluminum. Yes, yes sir, यही table याद किया था. Great. Yes, done. Which of the following is the most abundant antibody in serum? I contacted Surya sir, I have forgotten. Immunoglobulin G. For further details, microfaculty. I'm just showing you these questions because there are many people who put this into PSM, and that's the reason I categorically write that this is not PSM, this is an overlap. They are the better people to answer you more in detail. Which of the following is the shelf life of copper T388? 10 years. The way I remember, 80 लिखा है तो 10 है. ठीक है? So these are popular mnemonics. So 10 years. Again, refer to OBGY for this. After vasectomy, how many days patient should use a barrier method? Answer is, it should be either 3 months or 30 ejaculations. Again, OBGY question, put in PSM, depends on you, you put it here or not. Now, some partially recalled question which I would prefer your help. One was point source epidemic. So I don't know the exact question, I'll just tell you the concept. Rapid rise, rapid fall, in one incubation period, clustering of cases. Propagated, slow rise, slow fall, slow rise, slow fall, multiple incubation period. Yes, common source epidemic. Initially there will be a peak, then there will be a small thing. Okay, so if anyone knows about the exact question, please ping me, bachcha log. I will be more than happy to take your queries. Okay. Okay, who is not present in the school was the question. I am not present in the school, that's what I know. So probably the doctor is not present in the school. I don't know about the options. So again, this was one question. Third, maternity leave. Now it has been made 26 weeks, 6 months. It is pan India now. Abortion, 6 weeks. Yes. Okay. People of different religion in Delhi eating different types of foods and convert it into homogeneous population. Some question was like this. Now see, people of different religion, that means they're a heterogeneous population. Now I am converting them into a homogeneous population. So this is basically a stratified sampling where I am making meaningful subgroups. Yes. There was a question on propaganda. Again, I could not recollect it. Work absenteeism is basically the state of health workers. It is basically 8 to 10 days, which happens in India. So there were some 5 questions which I could not get a recall from the students. So anyone gets a recall, please feel free to share. I will again update the video. It's not a big deal. If you have any queries, please feel free to WhatsApp me, to email, or even follow me on Insta. I'm Dr. Siddharth, your host, your dost. Yes, DAMS-onian student and also a DAMS faculty since 2015 till jab tak hai Jan. That's all from my side. I hope you guys have enjoyed the session. I've kept it very short, sweet, smart, and sexy. So I hope don't worry. Bye bye. All the best. NEET PG people. Let's rock. See you.